and welcome to another day of Living with Spina Bifida. Today is Mental Health Monday, and today I am here with my plain old natural face. And you may notice that something is missing from my face. I don't have part of my eyebrow, and there is a very specific reason for such an occurrence. I've struggled with my eyebrows my entire adult life. I've never liked them. I don't look. I don't like the shape that they make. I don't like the way that I make the shape. Trust me, I know that I don't make very good eyebrows, especially when I draw them on my face, because I am a constant work in progress. And even though I am 30 years old, I still have a lot to learn, especially when it comes to how to make yourself look okay. So now we come to why would I be missing some of my eyebrow? I have what they call trichotillomania, also known as hair pulling disorder, which is characterized by the repetitive pulling out of one's own hair. It can be anywhere on the body that you have hair. Most often, the eyebrows and the actual hair on your scalp. Trichotillomania is one of a group of behaviors known as body-focused repetitive behaviors, in which individuals pick out their hairs, resulting in damage to the body. My damage being that hair on my eyebrows doesn't grow back properly. In most places, it doesn't grow back at all. Research indicates that about 1 or 2 in 50 people experience trichotillomania in their lifetime. It usually begins in late childhood and early puberty. In childhood, it can occur equally in boys and girls. By adulthood, 80 to 90% of reported cases are women. Hair pulling varies greatly in its severity and location on the body, and also response to treatment. Without treatment, trichotillomania tends to be a chronic condition that may come and go throughout a lifetime. So for me personally, it's obviously not that severe because it only occurs on my eyebrows. I don't actually pull out hair on my head or anywhere else on my body, and it only comes every 5 or 6 months. It's not very often. Trichotillomania is currently as an obsessive-compulsive and related disorder. The symptoms, obviously, is recurrent hair pulling resulting in hair loss, repeated attempts to decrease or stop the behavior, clinically significant distress or impairment in social, occupational, or other area of functioning. It is not due to a substance abuse or a medical condition such as a dermatological condition such as alopecia, not better accounted for by another mental disorder, but it is commonly associated with stress, depression, and post-traumatic stress disorder. Hair pulling may occur across a variety of settings and both sedentary and active activities. There are times when pulling occurs in a goal-directed manner, and also in an automatic manner in which the individual is less aware. That is usually my case. I'm usually watching TV or doing something that I am otherwise distracted with, and I don't realize that I've been pulling my eyebrow out the whole time until it's too late and I am missing my eyebrow. Many individuals report noticeable sensations prior to, during, and after pulling. A wide range of emotions, spanning from boredom to anxiety, frustration, and depression, can affect hair pulling, as can thoughts, beliefs, and values. Although the severity of hair pulling varies greatly, many people with trichotillomania have noticeable hair loss, which they attempt to camouflage, trying to draw on my eyebrows and usually failing terribly. Thinning or bald spots on the head may be covered with hairstyles, scarves, wigs, or makeup. Those with missing eyelashes, eyebrows, or body hair may attempt to camouflage with clothes, makeup, or other means. Due to shame and embarrassment, individuals not only attempt to cover up the effects of trichotillomania, but may avoid activities and social situations which may lead discovered. For some people, trichotillomania is a mild problem, merely a frustration. But for many, shame and embarrassment about hair pulling causes painful isolation and results in a great deal of emotional stress, placing them at a greater risk for a co-occurring psychiatric disorder. Physical effects such as pruritus, tissue damage, infection, and repetitive motion injuries to the muscles or joints are not uncommon. Those who ingest the pulled hair, they may experience gastrointestinal distress, even develop a hairball in their intestines or stomach, which can lead to a gastrointestinal blockage, require surgical removal. So, there you have it. Just another fun little quirk that I have to deal with in my life. And this is just another reminder that you don't know anyone's story, really, unless they flat out tell you. So, if you're gonna make fun of someone's hairstyle, or the way their eyebrows look, or if you're gonna make fun of someone at all, maybe you should just stop that. You're not that perfect. Obviously, if you're putting someone down on the internet, you can't be all that great of a person. But the people that you're putting down have struggles themselves. And it's more than likely that the thing that you're putting them down for, they are already well aware of this thing, and they probably already beat themselves up daily because of it. And you bringing it up is only making it worse. So the next time you want to be a jerk on the internet, maybe you should stop and think that those people are people and they have feelings, and it sucks to get them stepped all